I want to brief you the quarterly demands for second-hand drugs, SLDs. How to use this sheet? This is the standard sheet. You can uh, take it from the PTP website. That is downloadable. It is uploaded there. That this will be the standard. All others templates which are floating and are used should be discarded. So here in this demand, let's go to check and note that this is the video that is uh, used as a test. For example, this is the DR3B site, Shangla. So now here you have to write this demand for the quarter. So you can reach first quarter 2024. So let's come and calculate it. How many patients are there for BPaL? For example, one patient for two patients for BPaLM, one for LTR, one for modified STR, and zero for standard STR. So look at that. All these 1 plus 2 plus 1 plus 1, 5 patients are found that are under the treatment. So let's go at how you will fill this thing. This is your opening balance. For example, Maqsood is 500 uh, injections are present with you as the opening balance. Yes, the uh, columns are for the receiving of the drugs during the quarter. During first month, you received 20 injections, and during second and zero to third. Totally, you have received 30 injections. Now, for example, that the patient which are in which the amikacin is used, you have one patient, and for this, during first month, 30 injections are used. During second month, again, this was the one patient, and 30 injections were used. And during this third month, is again one patient was there, and 30 injections were used. Totally 90 injections are used, and average monthly consumption is 30. So now you will have the 440 injections left because we were having 500 and you received 20 plus 10, 30, 530, and you have used 90 injections. So from 540, 530, you will use 90 injections for 40 left. If you return some 120 injections to PTP and some, for example, 20 injections are expired, so the net closing balance will be 300. So this here the formula is applied. As per data you entered in this row, this demand was created as such. For example, we just change the data. You don't have the 120 injections you have, and you just return only 10 to this one. Now they don't look at 120 injection that you have, 30 you received, and 30 during first month, and 30 during second month, and 30 during third month, and total of 90 injections you use with the average monthly consumption of 30 injections. You return 10 injections to PTBKP, and 20s were expired, and 30s are left. So, based on your previous consumption during the quarter, you in this column demand for the next quarter you need 60 injections if you have the same pattern of the drug consumption. And if we will add of 1 month buffer stock, that will become 90. So this is very easy if you will do like this. In here, those columns are those cells in which formula is applied are protected. You cannot open them. So we'll have to enter the data only in the white colored cells, not the shaded cells. Shaded cells having the formula, they will automatically calculate it. Yes. So let's have example of some other 100 milligram betacholine. We have 200 tablets, and we received in first month 120, during 160 second month, and 0 during third month. So for two patients, you will have 60 tablets. For two patients again 60 tablets. For two patients again 60 tablets. So that will become on 80 tablets for the average monthly consumption of 6 tablets. You will have the 200 uh, tablets left. Among them, for example, you have returned 50 patients to 50 tablets to PTVKB, and nothing is expired. So you will have 150 tablets by the end of the quarter. So based on the previous consumption during your 3 months of the quarter, it is calculated automatically that 30 tablets are required during the next quarter. And if we will add the average monthly consumption, that is 60, then they will become 90 tablets. So this can be done with every drug you are using in your DRTB site. This was just a test video, which is having length 7 minutes and 10 seconds. So let us check it and then we'll go forward.